Imagine taking a pill every day, thinking it's helping your health only to discover years later that it's been slowly damaging your brain. For millions of seniors, this nightmare is reality. New research from a massive study analyzing data from over 130 million individuals has identified specific medications that may be silently increasing your dementia risk. Today, I'm breaking down which 9 common medications pose the greatest threat to your cognitive health and, most importantly, what you can do about it. Stay with me to discover 3 powerful foods that research suggests might help protect your brain even if you need to continue taking these medications. Did you know the pills sitting in your medicine cabinet right now might be silently affecting your brain health? Many seniors are shocked to learn this truth. Those daily medications you've been taking for years, the ones prescribed by doctors you trust, could potentially be contributing to cognitive decline. It's something most healthcare providers aren't discussing with their patients, yet research is revealing concerning connections that every senior should know about. Recent studies have uncovered alarming links between commonly prescribed medications and cognitive decline. These aren't obscure drugs. They're medications that millions of seniors take daily to manage chronic conditions. The medications helping you sleep, easing your stomach discomfort, or controlling your allergies might be impacting your brain health. The statistics paint a concerning picture. Over 40% of adults aged 65 and older take at least 5 prescription medications regularly, and nearly 20% take 10 or more. Many of these medication regimens include at least one drug with cognitive side effects. This medication buildup works like an escalator of risk. The higher you go with multiple medications, the greater your potential cognitive decline. Why aren't doctors discussing these risks? According to multiple surveys, less than 25% of seniors report having a comprehensive medication review with their doctor in the past year. This communication gap leaves many older adults vulnerable to risks they don't even know exist. A groundbreaking analysis looking at data from over 130 million individuals has revealed medication dementia connections that researchers had previously overlooked. This massive study allowed scientists to identify patterns that smaller studies couldn't detect, confirming that certain classes of commonly prescribed medication show stronger associations with cognitive decline than others. These medications work silently, gradually impacting cognitive function over months or years of use. The longer you take them, the greater the potential impact on your brain health. This slow progression makes it difficult to connect cognitive changes to medication use. Early warning signs can be subtle and easily dismissed. Harvard Health Publishing notes these cognitive changes are often misattributed to normal aging rather than medication side effects. Seniors might notice increasing forgetfulness and assume it's just part of getting older, when it could be related to their medication regimen. Being vigilant about changes in your cognitive function is crucial. The American Geriatric Society's Beers List identifies several drug categories warranting special caution due to their potential cognitive impacts. Watch for these warning signs: unusual drowsiness, difficulty finding words, sudden confusion with familiar tasks, increased falls, changes in sleep patterns, decreased concentration, or personality changes. If you notice these symptoms, don't automatically attribute them to aging. Consider discussing your medications with your healthcare provider. The medication classes showing the strongest links to dementia risk include anticholinergics, found in many common allergy and sleep medications, benzodiazepines, anxiety and sleep aids, and certain antipsychotics. Research shows long-term use of these medications is associated with an elevated risk of cognitive decline, with some studies showing risk increases of 50% or more for regular users. Have you ever checked the labels on those over-the-counter medications in your bathroom cabinet? That allergy pill or sleep aid you've been taking regularly might be more concerning than you realize. Of all the medication categories we've discussed, anticholinergics deserve special attention because they directly attack your brain's memory center. The way these drugs work is particularly troubling for seniors whose brain chemistry is already changing with age. Anticholinergic medications block acetylcholine, a crucial neurotransmitter essential for memory and learning that helps your brain cells communicate. When you take these drugs, you're essentially creating roadblocks in your brain's communication network, like closing major intersections in an already congested city during rush hour. This prevents important neural messages from being delivered throughout your brain. This creates a dangerous situation for seniors specifically. Your body naturally produces less acetylcholine as you age, so when seniors take anticholinergic medications, they experience a double impact, a natural decline in this vital chemical, further depleted by medications. It's comparable to a city with half its streets already closed for construction, then having someone block the few remaining open routes. The evidence against these medications is compelling. A major study published in JAMA Internal Medicine found people taking strong anticholinergic medications daily for just 3 years had approximately a 50% higher risk of developing dementia. This comprehensive study examined thousands of patients while controlling for other potential causes, making the connection difficult to dismiss. Common anticholinergics many seniors use include antihistamines like diphenhydramine, Benadryl, and many sleep aids. Certain antidepressants like paroxetine or Paxil. Medications for irritable bowel syndrome like dicyclomine aka Bentyl. Bladder control drugs like oxybutynin, ditropan. Over-the-counter sleep medications containing doxylamine like Unisom. What makes these medications particularly problematic is their ability to cross the blood-brain barrier, the protective shield that prevents many substances from affecting your brain. When anticholinergics bypass this protection, they directly impact brain function, interfering with memory formation and cognitive processing. Many people who have discontinued these medications experience remarkable improvement. Anticholinergic side effects often mimic dementia symptoms, creating confusion for both patients and doctors. These include memory problems, impaired reasoning, disorientation, confusion, drowsiness, dry mouth, urine retention, and constipation, significantly impacting seniors' quality of life. The risk increases with both the potency of the anticholinergic effect and duration of use. Taking multiple medications with mild anticholinergic properties can create a stronger combined effect, what researchers call anticholinergic burden. This is particularly concerning since many seniors take several medications daily. While anticholinergics represent a significant concern for cognitive health, they're not the only medication category to watch. 2 other major medication types show similarly troubling connections to cognitive decline, which we'll discuss shortly. But first, let's examine which specific anticholinergics appear on medical watch lists. Beyond the anticholinergic medications we just discussed, there's another category of drugs that over 10 million American seniors take regularly for sleep and anxiety issues. These medications work directly on your brain's GABA system, but while they may calm your nerves tonight, research shows they might be setting the stage for serious cognitive decline tomorrow. The connection between these common sleep aids and dementia risk has many doctors rethinking their prescribing habits. Benzodiazepines and their cousins, Z drugs, are some of the most frequently prescribed medications for seniors struggling with anxiety and insomnia. You might recognize names like Xanax, Valium, Ativan, and Restoril on the benzodiazepine side, or Ambien and Lunesta among the Z drugs. These medications provide welcome relief when anxiety becomes overwhelming or when sleep proves elusive night after night. Consider Vera, a 75-year-old who started taking Ambien after her husband's passing, left her staring at the ceiling most nights. The medication helped her sleep again, but after 2 years of nightly use, her children noticed she struggled to recall recent conversations and seemed increasingly confused about familiar tasks. Research has uncovered a troubling link between long-term use of these medications and increased dementia risk. Seniors who take these drugs for extended periods face significantly higher odds of cognitive decline compared to those who don't use them. The risk climbs steadily the longer you take them. Higher doses mean greater risk. Daily use for years carries substantially more concern than occasional short-term use. These medications enhance the effects of GABA, gamma aminobutyric acid, a neurotransmitter that decreases neural activity, essentially putting the brakes on an overactive mind. This slowing mechanism helps reduce anxiety and promote sleep short term. However, this artificial manipulation of brain activity might contribute to cognitive problems in the aging brain, which requires a delicate balance of neural activity to function optimally. As we age, our bodies process medications more slowly. These drugs stay in our systems longer, potentially causing more cognitive side effects. Even short-term benzodiazepines and Z drugs can cause confusion, memory problems, and clouded thinking, symptoms remarkably similar to early dementia, making diagnosis challenging. The American Geriatric Society has placed these medications on their Beers list, a compilation of drugs considered potentially inappropriate for older adults. Despite this warning, millions of seniors continue taking them, often unaware of the potential long-term cognitive effects. The medications showing strongest links to dementia risk include alprazolam, Xanax, diazepam, Valium, clonazepam, or Clonopy, and Zolpidem, Ambien. If you're currently taking any of these, don't stop suddenly. Withdrawal can be serious. Discuss your concerns with your healthcare provider. Watch for subtle cognitive effects, trouble finding words, confusion about familiar tasks, or memory gaps beyond normal aging. These aren't just senior moments, they could be medication side effects requiring attention. Fortunately, alternatives exist that don't carry the same cognitive risks. Cognitive behavioral therapy for insomnia can address the root causes of sleep difficulties rather than masking symptoms. Mindfulness meditation and breathing exercises can effectively manage anxiety without medication. When medications are needed, options with better safety profiles for cognitive health exist. For Vera, gradually tapering off Ambien under doctor supervision and starting a structured sleep hygiene program restored both her sleep and mental clarity within months. The trade-off between immediate relief and long-term brain health is one every senior taking these medications should carefully consider with their healthcare provider. While non-drug approaches can help with anxiety and sleep issues, there's another daily medication sitting in many seniors' medicine cabinets that deserves careful attention. Those little purple pills that millions take each morning for heartburn could be silently affecting brain health in ways researchers have only recently discovered. A shocking study published in the journal Neurology found that taking proton pump inhibitors, or PPIs, for just 4 years increased dementia risk by 33%, compared to those who never used these medications. You've probably seen the commercials for Nexium, Prilosec, or Prevacid. These powerful acid-reducing medications have become a staple for seniors struggling with heartburn, acid reflux, and GERD. What started as occasional relief is transformed into a daily ritual for millions, with these pills sitting right alongside blood pressure and cholesterol medications in weekly pill organizers across America. These medications are like silent guardians of stomach comfort, dramatically reducing acid production to relieve heartburn symptoms. However, this immediate relief may come with a long-term cost that isn't mentioned in those glossy commercials. Originally approved for short-term use of just 8 to 12 weeks, these medications now find themselves in daily pill routines for years or even decades. The potential mechanisms behind this PPI dementia link are particularly troubling. Long-term PPI use can interfere with your body's ability to properly absorb vitamin B12, which plays an essential role in maintaining healthy brain function. Without adequate B12, cognitive decline becomes more likely, especially as we age. Evidence also suggests PPIs may contribute to the buildup of beta-amyloid plaques in the brain, the same type of plaques found in Alzheimer's disease. These plaques disrupt communication between neurons and are a hallmark of cognitive decline. The medication relieving your stomach discomfort today might be changing your brain in subtle ways that only become apparent years later. Many seniors receive their initial prescription during a hospital stay or acute stomach issue, yet continue refilling these prescriptions for years afterward without regular reassessment. Unlike the distinctive drowsiness that might signal a problem with anxiety medications, The potential cognitive effects of PPIs develop slowly and might be mistaken for normal aging. The statistics on PPI use among seniors are eye-opening. Older adults are nearly twice as likely to receive PPI prescriptions compared to middle-aged adults, and they typically take them for much longer periods despite being more vulnerable to potential side effects. Gastroenterologist Dr. Lucy Ju emphasizes the importance of regularly reassessing medication regimens. Patients should work with their physicians to ensure the continued benefits of PPIs outweigh any potential risks. This is especially crucial for seniors who may process medications differently due to age-related changes in metabolism. Fortunately, alternatives exist for managing acid reflux. Dietary modifications like limiting trigger foods and mechanical approaches like elevating the head of your bed can provide significant relief. When medications are necessary, options like antacids or H2 blockers might be appropriate for some individuals. If you're currently taking a PPI, schedule a conversation with your doctor about whether continued use is appropriate for your situation. Should you decide to discontinue, remember that stopping suddenly can trigger rebound acid hypersecretion, where your stomach produces even more acid than before. Your doctor can guide you through a gradual reduction if needed, as the weaning process varies from person to person. While research shows an association between PPIs and dementia risk, it doesn't definitively prove these medications directly cause cognitive decline. Your decision about PPI therapy should always involve weighing the benefits against potential risks with your healthcare provider. The groundbreaking 2020 population-based study revealed that beta blockers, those common blood pressure medications taken by over 30% of seniors, increase the risk of vascular dementia by nearly 40% compared to those using alternative treatments. Yet many patients remain unaware of this potential side effect despite years of faithfully taking these pills. This connection between medications and brain health extends far beyond acid reducers and sleep aids. Statins, which millions rely on to manage cholesterol, have been linked to cognitive issues in certain cases. While these medications save lives by preventing cardiovascular events, some patients experience brain fog, subtle changes in thinking and memory after starting statin therapy. These medications may affect how cholesterol functions within brain cells, potentially altering neurotransmitter activity. Corticosteroids present another concern for seniors' cognitive health. These powerful anti-inflammatory medications can disrupt crucial neurotransmitters when used long-term, sometimes resulting in steroid dementia, a potentially reversible form of cognitive impairment that often improves when the medication is tapered under medical supervision. Opioid pain medications create additional risks for aging brains. While providing essential relief for severe pain, research has uncovered connections between long-term opioid use and accelerated cognitive decline in older adults, creating a difficult balancing act for seniors managing chronic pain conditions. What's particularly concerning is medication burden, the cumulative effect of taking multiple medications that affect brain function. Imagine your brain as a delicately balanced scale. Each medication adds weight to one side until eventually the scale tips toward cognitive decline. While one medication might pose minimal risk, combining several creates a perfect storm that dramatically increases dementia risk. This is especially relevant for seniors managing multiple health conditions with various prescriptions. But there is hope. Nature offers its own remedy. Powerful compounds in certain foods may help shield your brain against medication-related risks by supporting cognitive function and potentially counteracting side effects. Fatty fish tops the list of brain-protecting foods. Salmon, mackerel, and sardines deliver omega-3 fatty acids that serve as fundamental building blocks for healthy brain cell membranes. These essential fats reduce inflammation throughout the body, including the brain. For seniors concerned about medication effects, incorporating fish twice weekly provides significant protection. Even a simple broiled salmon with lemon can deliver these benefits. Berries provide another delicious way to support brain health. Blueberries contain anthocyanins that combat oxidative stress, a major contributor to cognitive decline. These compounds act like protective shields, neutralizing damaging molecules before they harm neural tissue. Adding a handful to morning oatmeal or blending frozen berries into a smoothie offers a simple yet powerful way to boost brain resilience against medication-related risks. The third powerful brain ally is turmeric. This vibrant yellow spice contains curcumin, a compound that crosses the blood-brain barrier, the protective filtering mechanism that prevents many substances from reaching brain tissue. Once inside, curcumin may help clear amyloid plaques associated with Alzheimer's disease. Seniors can easily incorporate it by sprinkling it into scrambled eggs, adding it to soups, or enjoying golden milk. Warm milk with turmeric, cinnamon, and honey as an evening ritual that supports brain health. For seniors taking medications with potential cognitive side effects, these natural brain protectors offer a complementary approach to maintaining mental sharpness while managing necessary medical treatments. We've covered a lot of ground today, but here's what it all comes down to: taking charge of your medication health. Studies show that regular medication reviews with your doctor can significantly reduce inappropriate prescribing and the associated risks. It's a proven strategy for protecting your brain health. When you visit your physician, bring a complete list of everything you're taking and ask about alternatives to anticholinergics, benzodiazepines, or PPIs. Remember, never stop these medications suddenly without medical supervision. By combining this proactive approach with brain protective foods, you're taking control of your cognitive future. Will you make that appointment today? Thanks for watching and subscribing to our channel, and remember, the best of your healthy golden years are ahead of you. See you in the next video.